Hello, my name is Kathy, and today I'll be discussing how to use homeopathic remedies on ailments, continuing with small intestine, large intestine, liver, gallbladder, and pancreas ailments, starting with the letter A, Part 2. But before I do this, I wanted to let you know that because I have a great many videos now on many different topics, that I've decided to make several different video playlists so that it's easy to find the videos of greatest interest. So please check out my playlist page. Please refer to my How to Use Homeopathic Remedies video before using the material in this video. I'll be discussing how to use homeopathic remedies on specific ailments, but I've broken these ailments into categories for easier reference. I'll begin with ailments of the mind and emotions, then I'll move on to ailments of the brain and nervous system, then I'll address issues with the skin, nails, hair, eyes, ears, nose, teeth, gums, lungs, respiration, heart, blood circulation, muscles, bones, joints, esophagus, stomach, duodenum, small and large intestines, liver, gallbladder, pancreas, kidney, bladder, then ailments specific to women and specific to men, then issues of the hormones and the metabolism, and then address issues of infections, infestations in the immune system, then issues surrounding fertility, pregnancy, and surrounding childbirth and postnatal problems. Then homeopathic remedies that address special problems in infants, ailments and diseases in childhood, and special issues of adolescence. And finally, special issues of the elderly. Constitutional treatment involves treating the totality of the individual person. Everyone is a unique individual with a unique physiology that responds to substances differently. In homeopathy, it is recognized that people will react strongly to certain remedies, and as a result of this, they can be loosely placed into different categories called constitutional types. Homeopaths talk of, for example, phosphoric types. These are people who react strongly to phosphorus, or arsenicum album types, those who react strongly to arsenicum album. The belief is that people of one type share similarities in terms of body shape, character, and personality, and the sorts of diseases from which they suffer. As an example, Ratanbia people tend to be pear-shaped, have a dark complexion, be fastidious and rigid in personality, and keep themselves to themselves. They also crave salt and suffer from constipation. As another example, Lycopodium types tend to be tall, gangly, and of a stooped appearance, with an anxious expression and a craving for sweets and a propensity to produce intestinal gas. Now, of course, constitutional types have their limitations. In reality, each person is an individual, and so there are as many constitutional types as there are human beings. An account must be taken of the sum total of the person's inherent predispositions, past illnesses, diet, general reactions to the environment, intellectual and emotional features, and general attitude towards life. This is what is meant by constitutional treatment. I'll be making detailed videos of the various constitutional types after I've completed the use of homeopathic remedies on ailments. The ideas, procedures, and suggestions in this video and all my homeopathic videos are not intended as a substitute for the medical advice of a trained health professional. Consult your physician before adopting the suggestions in this video. If you're pregnant, do not attempt these techniques without the approval of your physician. So let us continue with learning how homeopathic treatments can help with small and large intestine, liver, gallbladder, and pancreas ailments that begin with the letter A, Part 2. From the stomach, food enters the duodenum and small intestine. The food is then squeezed into the cecum through a small valve, then passes into the ascending, transverse, and descending parts of the colon, or large intestine, and finally to the rectum and anus. The total distance between the stomach and the anus is about 26 feet. The whole journey takes 18 to 30 hours from the time the food leaves the stomach. The liver and pancreas empty their digestive secretions into the duodenum through a common duct, the bile duct. Bile produced by the liver emulsifies fats, and enzymes produced by the pancreas get to work on proteins, starch, fats, and sugars. The liver does many things besides aiding digestion. It stores glycogen, a compact form of glucose, and also vitamins A, B, D, E, and K. It removes toxins, for example alcohol, from circulation. It manufactures blood proteins and blood clotting agents. It synthesizes cholesterol, a vital component of all cell membranes and the precursor of many hormones. It converts saturated fats to unsaturated fats when the body is obliged to use fat rather than glucose for energy. It breaks down and recycles the iron-rich oxygen-carrying pigment hemoglobin. It dismantles excess amino acids and excretes their nitrogen-containing components into the blood as urea. Urea is one of the constituents of urine. It also produces a great amount of heat because of all the chemical reactions going on inside of it. The pancreas is a gland about 6 inches long, lying beneath and behind the stomach. It produces large amounts of sodium bicarbonate as well as digestive enzymes. Sodium bicarbonate is alkaline and therefore neutralizes the hydrochloric acid produced by the stomach. It also produces 2 important hormones, insulin and glucagon, which control sugar uptake by every cell in the body. The gallbladder has no secretory function. It merely stores and concentrates bile sent to it by the liver and empties it into the duodenum in response to a hormone that is secreted whenever fatty food leaves the stomach. The small intestine has 2 functions: to complete the food breakdown process and to absorb nutrients into the bloodstream. Although it is only 21 feet long, it has a total absorptive area of about 200 square feet. This is because its inner walls are lined with millions of finger-like projectiles called villi, each containing blood capillaries and tiny tributaries of the lymphatic system called lacteals. Amino acids, glucose, small fat droplets, vitamins and minerals pass into the capillaries and large fat droplets into the lacteals. Whatever remains unabsorbed by the small intestines, about 5% of fats, 10% of amino acids, fiber, some vitamins, bacteria, intestinal secretions, salts, water, passes into the colon, where it is gradually compacted into semi-solid feces. The bacterial population of the colon manufactures vitamin K, B12, B1, and B5, and certain amino acids. These are absorbed by the walls of the colon together with salts, water, and other valuable substances. Transit time through the colon depends mainly on the amount of roughage in the diet. Too little roughage causes constipation and related ailments such as hemorrhoids and diverticulitis. Anal fissure. An anal fissure is an elongated split in the rectum close to the anal sphincter, often associated with internal piles. Though rare, this condition is most common in middle age, but does affect some children. When a stool is passed, the split is irritated, causing the sphincter muscle to go into painful spasms. The split may also bleed. Constipation is the root cause. Orthodox treatment is to soften the stools with liquid paraffin or to use KY jelly to make the stool pass less painfully. In some cases, stretching of the anus or surgery may be necessary. Specific remedies. To be taken 4 times daily for up to 14 days. For sore burning pain from the fissure, with aching in the lower back and the stools are large, dry, hard, and knobbly, use Asculus, A-E-S-C-U-L-U-S, Asculus 6C. For sore smarting pain upon passing stools, which are lumpy and covered in mucus, use Graphites 6C. For sharp, spiky pains during and after passing stools with constipation, chilliness, and irritability, use Nitric Acid 6C. For burning or stabbing sensations in the rectum that are worse after passing stools and the bowels are loose or constipated, use Ratanbia 6C. That's R-A-T-A-N-B-I-A 6C. Self-help. Increase the amount of roughage in the diet and especially raw vegetables. Add natural laxatives to the diet for a while until regular bowel habits are established. Anal fistula. Anal fistula is a rare condition in which an abscess in the rectum erodes a tiny canal. A fistula through to the skin somewhere near the anus and discharges watery pus through it. The abscess may or not be painful and may be associated with Crohn's disease or cancer of the rectum. Standard procedure is to clean out the abscess under local anesthetic so that the fistula heals. Specific remedies to be taken every 4 hours up to 14 days. If the abscess is painful, use Calcarea Sulph 6C. If there is still discharge after the abscess has been cleaned, use Silicea 6C. For stitching pains that dart up the rectum made worse by coughing or sneezing, use Lachesis 6C. Self-help. Bathe the anal area with hypocarium and calendula solution. 5 drops of the mother tincture of each in a half pint of boiled then cooled water. Appendicitis. Appendicitis is an infection and swelling of the appendix due to increased activity of harmful bacteria inside it. It seems to happen when the appendix is partially or totally blocked off from the colon by hard fecal matter, a swollen lymph gland, a tumor, or even a tapeworm. The appendix either bursts, releasing pus into the abdominal cavity and causing peritonitis, or the surrounding tissues envelop it in an abscess, effectively sealing it off from the rest of the abdomen. The classic symptoms are vague pain around the navel, followed by a loss of appetite, constipation or diarrhea, then nausea and vomiting. Then the person develops a fever and the pain becomes sharp and moves to the lower right abdomen and feels very tender. A burst appendix causes severe pain that is not relieved by vomiting and a distended abdomen. If appendicitis is suspected, see a doctor within 12 hours. If the appendix bursts, call 911. The cure is usually swift, surgical removal. But if an abscess is formed, removal may be delayed until the infection in the surrounding tissues can be cleared up by antibiotics. Specific remedies to be taken every 15 minutes for up to 10 doses while waiting for help. The face is red and hot, and the slightest movement makes the pain worse. Use Belladonna 30C. If even the slightest touch of the hand on the skin over the appendix area causes intense pain, use Bryonia 30C. For cutting, tearing pains, and the abdomen is distended and the skin over the appendix is acutely sensitive, and the person is extremely touchy and irritable, use Lachesis 6C. If the pain is most intense over the appendix area, use Iris 10 6C. Self-help. Go to bed, eat nothing, and drink only water. Even if you are constipated, do not take laxatives. A high-fiber diet with plenty of green vegetables is the best preventative. I have a great many videos now on many different topics, and so I've decided to make several different video playlists so that it's easier to find the videos of greatest interest. So please check out my playlist page. Well, that's it for now. To stay up to date with my latest videos, make sure to subscribe to this free YouTube channel by clicking the red subscribe button right below this video. Take care.